20 years ago, we opened our doors to the businesses and individuals of Northwest Georgia. So much about health insurance has changed over the last few years, but a few core things have not. Our members are the reason we're here, and we strive daily to serve you well.
How can I help you today?
We want to thank our members for choosing us each year as their health plan. Tens of thousands of you chose Alliant this year. We don't take that choice or that trust lightly. We're Alliant, and we're here for you.
Well, hi everyone. Thanks for joining us. Individual health insurance, we all need it to help cover the cost of medical care. And now is the time to choose your health insurance coverage for 2018. But maybe you have some questions about how to shop for your plan. Today, I'm here with Angie Fussell from Alliant Health Plans, who's going to help us with some of those frequently asked questions. And Angie, thank you so much for being with us today.
You're welcome. It's my pleasure.
You know, we talked about it just a few minutes ago. I was talking with you about it is time to move on making a plan for your health insurance, and I know time is of essence. Tell me when the deadline is and all about what we need to be doing.
It is that time. We are currently in the middle of open enrollment. Mm-hmm. Open enrollment is the time period that you can make changes to your health plan, or you can buy a new health plan for next year. It actually started November 1st, mm-hmm. and the deadline is December 15th. So it is time. So Friday, December 15th, mm-hmm. if you have not enrolled in a plan for 2018, you're out of luck. You won't have a plan for 2018.
Yeah, that's sad. You wouldn't have insurance. My goodness.
You have to act quickly.
Wow. Yeah. You know, and I think a lot of people, particularly this time of year, it's a rush time. We're all busy. We all have different things and responsibilities. Just to sit down and make sure that you're enrolled by the 15th. And there are different ways that we can do that, but that is very important for this deadline coming up.
It is. It is.
Tell me how I can go about buying insurance, or what can I do? How do I buy it?
Well, there are multiple avenues that where you can purchase your health insurance, but I want to talk about 3 places that you can shop, mm-hmm. and you can compare plans. The first is Healthcare.gov, and it's probably your first stop. Mm-hmm. You need to visit the Healthcare.gov site. Secondly, you can visit or talk to a licensed health insurance broker, mm-hmm. or you can call our customer service department at Alliant Plans, and we'll be glad to help walk you through the process.
Right, and I know we talked a little bit earlier, you know, with the information that you have when you go online. It's so easy because, well, it can be easy for some people, but for those who are not able to go online and do their own, you do have other options that can be helped.
We do. You know, we've tried to think of all of those issues for folks to make it as easy as possible. Mm-hmm. So for our Spanish-speaking population, they can call customer service. Healthcare.gov also will accommodate different languages. They can, if you're local in the Dalton area, you can also visit our office on Tibbs Road, and someone will sit down and help walk you through the process as well.
Well, that's great, because there are different options that you can go through to make sure that you have insurance by December the 15th. Right. But you know, we also was talking earlier, when you go online at healthcare.gov, you can also look at the various different plans, and it kind of customized to what you need personally, because one thing doesn't fit everyone else. That's what I love about being able to look at that whole spread when you're online.
That's right. And you can go to healthcare.gov, and it will walk you through step by step everything that you need to know. It will ask you specific questions. When you set up the account, it's going to ask you your income level, and so immediately you're going to find out what you qualify for, if it's subsidies or if not. Mm-hmm. Also, if you talk to a broker, they can also walk you through, look at your entire personal mm-hmm. Plan, your finances, mm-hmm. how often you go to the doctor, the prescriptions that you take, and they can help walk you through mm-hmm. And find a plan that suits your personal needs as well. And so can anyone at the Alliant mm-hmm. customer service as well.
Right. So it really isn't that difficult to get into a plan. It's just a little bit of time that you need to take to make it happen.
Absolutely.
It's well worth it.
Absolutely. You don't want to be without a plan next year.
Exactly. And again, if we do not have this action by the 15th of December, then we're out of luck for the first part of the year.
That's right.
For the entire year, actually.
That's right.
Tell me a little bit about how do you qualify? I know that there are different ways that people can get assistance.
Right.
And you have a chart here. Let's take a look at this chart,
Okay.
and let's kind of describe this and what it involves.
Okay. When you go on healthcare.gov, it's going to allow you to compare different plans, and it's going to ask you to input your income. And based on that yearly income, it will tell you if you qualify for a subsidy. So I just have some examples on the slide here. And this is all for a silver plan. So if you're an individual and your income is from $12,060 to $48,200, you will qualify for some subsidy money. Mm-hmm. If that income is between $12,060 and $24,000, your silver plan premium will actually be free on a monthly basis. You will just be responsible for your deductibles and other cost sharing. Mm-hmm. For a couple, that income will be $16,240 to $65,000, where you will receive some subsidy. But you will receive free premiums if your income is $16,240 to $40,250. Then if you have a family of 4, for example, and your income level is $24,600 to $98,500, you will receive some subsidy money. If your income is $24,600 to $66,000 as a family of 4, you will receive free premiums on that silver plan on a monthly basis.
Really?
Mm-hmm. So it's worth going to healthcare.gov to see if you qualify.
Definitely. And then again, if you're not able to, or you do not have access to a computer, you can still get assistance, and they can still look all this up for you.
That's right. They have an 800 number.
Right.
And I think we're going to put that on the screen as well for people's reference.
So you can call
absolutely
directly, or you can get online. There's so many different ways that you can get help with getting your insurance for the 15th. Now let's talk about what you need to know when you go online or when you meet with your licensed broker. What kind of information do you need to take with you, or you need to have at hand?
Well, you'll have to have your income information. So your income taxes will be a necessity, and of course your dependent information, Social Security numbers and so forth. But again, the healthcare.gov site or the 800 number, they're going to help you and let you know. And then once you set up the account, you can always come back if you need to gather additional information.
Right. That's wonderful. Tell me a little bit about a lot of people, and I know we covered this a little bit earlier, they may need guidance, and they do have a lot of questions, but again, you can call Alliant directly and get that information.
That's right. Or you can visit us personally.
That's easy.
Our Tibbs Road location, someone will be happy to sit down and help you. So that address is also going to be on the screen for people.
Okay. I have found that Alliant is so customer service oriented as well.
We like to hear that.
No, I'm serious. I mean, we hadn't planned to talk about that, but customer service is really, really great at Alliant Health Plans.
You know, the community likes to hear that we're local. We're based here in Dalton. We actually have plans on the exchange in 24 counties in North Georgia, so everything that we offer on the exchange is going to be in the North Georgia area. And people like to hear that we're locally based in a small town.
That's right. And I don't think, although you may think that people realize that, but I can assure you there are probably a lot of people who do not know that. They hear the name, but they really don't know the connection with the community.
Right. So we're very proud of that.
Yeah,
we're very proud of our participation in the community as well.
Right. I've also found when I've had a question or needed a call, and I call directly, they can really find out an answer rather quickly for me. So
good. We like to hear that. That's what we strive for.
So today we want to make sure that you go start taking action if you've not made any action to get your health insurance. Do this by
December 15th.
All right. Now, what happens if they do not respond? I want to make sure people understand this. They don't do anything, and it's after the 15th of December. What happens?
They will not have an active health insurance product for next year.
And that is a bad situation to be in.
Absolutely.
All right, so don't forget, make your plans now. Let's go over the various ways that they can start taking action to make sure they are covered by the 15th.
Right. They can go to healthcare.gov, or they can call the 800 number and reach healthcare.gov. They can call Alliant directly and talk to a customer service relations representative, or they can work with a local broker. When you go on healthcare.gov, it's going to allow you to compare different plans, and it's going to ask you to input your income. And based on that yearly income, it will tell you if you qualify for a subsidy. So I just have some examples on the slide here. And this is all for a silver plan. So if you're an individual and your income is from $12,060 to $48,200, you will qualify for some subsidy money. If that income is between $12,060 and $24,000, your silver plan premium will actually be free on a monthly basis. You will just be responsible for your deductibles and other cost sharing. For a couple, that income will be $16,240 to $65,000, where you will receive some subsidy. But you will receive free premiums if your income is $16,240 to $40,250. Then if you have a family of 4, for example, and your income level is $24,600 to $98,500, you will receive some subsidy money. If your income is $24,600 to $66,000 as a family of 4, you will receive free premiums on that silver plan on a monthly basis.
Really?
So it's worth going to healthcare.gov to see if you qualify.
Okay, and also come in to visit at Alliant
Absolutely,
if the need be for that.
If the need be.
Okay, great. Well, I want to say thank you so very much, Angie, for coming out, being with us, and for providing this information to us. We appreciate it.
Thanks for having us.
Thank you.
20 years ago, we opened our doors to the businesses and individuals of Northwest Georgia. So much about health insurance has changed over the last few years, but a few core things have not. Our members are the reason we're here, and we strive daily to serve you well.
How can I help you today?
We want to thank our members for choosing us each year as their health plan. Tens of thousands of you chose Alliant this year. We don't take that choice or that trust lightly. We're Alliant, and we're here for you.
I am from Dalton, Georgia, and I love working for Alliant. I mean, Alliant strives to do good things in our members' lives and also in the lives of our community.
At Alliant Health Plans, we want to focus on obtaining the highest quality of care for our provider network. And in doing that, our criteria for our physicians and our nurse practitioners, our facilities to come in network, adheres not only to the national standards, but we also go above and beyond that.
When you're healthy, it almost doesn't matter who the ownership is of your health plan, but when you get sick, it sort of matters that physicians and hospitals own the health plan, because at the center of the decision making is how do we best deliver care.
I think it's important being a provider-owned entity because they look at this from more of a global perspective with the patient in mind in all things. This is not about this quarter's earnings. This is about a community, improving the health of that community.